what is the treatment for black fungus, and what are the precautions the public can take to avoid getting infected with this?
Treatment for black fungus involves surgery in most cases, along with antifungal treatment, and the drug of choice being liposomal amphotericin B. Now, one of the messages that I would like to give to the public and the people seeing this video is that when there is black a discoloration of body parts, especially around the nose and the eyes, as I mentioned before, it is imperative that we debride, that we clean up this area which is a piece of necrotic tissue. So debridement means going in surgically and cleaning up the decaying or the dead tissue. This is fundamental in the treatment of mucormycosis. If we give only antifungals, these antifungals do not reach the dead tissue because of the fact that there is a ischemia and blockage of the blood vessel by angioinvasion, as I told you before. So these medicines don't actually reach the area of infection. So that's the reason why the dead tissue has to be removed, and then antifungal treatment has to be initiated, and this goes on depending on the severity of the infection up to 6 to 8 weeks or even more in some cases. So treatment, again to summarize, is most often surgery along with antifungal treatment. Now, what are the precautions? Now, I've been dealing with this and speaking to various authorities and being a part of the Mucor subcommittee. I would like to tell you that we would categorize this as community factors and responsibilities, and then hospital factors and responsibilities. Now, in the community, there are various ways that one can contract mucor, and the community factors begin with improper use of masks. Now, when we are wearing masks, I see a lot of people using the same mask for several days. Masks such as these, the N95 masks, are to be used for 8 to 10 hours, and they're a single-use mask, but I know that many people use the mask for long periods of time. Now, what can happen when we use a mask for a long period of time is that we sweat into the mask, the salivary droplets accumulate on the inner surface of the mask, food particles may come out of the mouth while we speak, and that also gets deposited, and all this is a recipe for disaster. So people nowadays are using double masks. That's double the problem. So masks are an important part of our lives now because of the COVID pandemic, but there's a certain way in which we have to use a mask. So mask usage. Second thing is steam inhalation. A lot of people, with whom I've, a lot of patients, in fact, with whom I've interacted with in the last few months, or probably the whole of the last year, have told me that they are regularly doing steam inhalation, probably even 2 to 3 times a day. Now that's overdoing things. Now when you're doing steam inhalation, you may damage the nasal mucosa, because we've all inhaled steam, and we often tend to kind of singe our nose. We get this stinging sensation in the nose because of the heat, and any such burning of the nose due to repeated steam inhalation can lead to a nasal mucosal breach, which can predispose to fungal infections. So steam inhalation is not a great idea, especially in COVID infected patients who have received nasal oxygen for a long period of time. So their nasal mucosa is anyway fragile, and then if you inhale steam and cause a little bit of irritation, burning, that is going to create problems. The government has allowed the public to buy oxygen concentrators, and that being a medical device, I am certain that a lot of people out there do not know how to effectively use a concentrator. So concentrator requires distilled water or sterile water to be used in the humidifiers, and these devices have to be sterilized appropriately. Now this is something probably the public wouldn't know, and unless it's done properly, this can prove counterproductive. And because we are staying at home indoors for a long period now, we should look at the environment inside the house. If there are contaminated AC vents with a lot of fungal elements, fungal spores, which have not been cleaned for a long period of time, because of the fact that we have we have been staying indoors for a long period of time. This can lead to spore infiltration, especially if there is a COVID patient who's been, let's say, inhaling steam, So, and the waste disposal that's happening in our houses. Waste disposal is not happening as regularly as it used to happen before. Earlier, we used to see these guys coming in and taking the waste almost every day. But now, because of the stressed nature of the times that we're living in, we are left with waste lying in our house for a couple of days before they're actually taken out. So all these can lead to fungal growth and increased spore concentration within the house. And to add to that, if there are plants, upholstery, carpets, all this, and all this it will be a factor because we are in a lockdown status and we're staying indoors. So these are all community acquired status, and we all can avoid some of these factors by getting rid of some of these factors by maintaining more hygiene in our own homes and workplaces. And then we have nosocomial factors, which are hospital acquired factors. Hospitals too are stressed. So, our recommendation to the government of Karnataka has been to make sure that the hospitals take more stringent measures to ensure that there's no cross infection, there's no hospital acquired infection, what we call nosocomial infections, which then lead to infection in the immunocompromised host. And when I say immunocompromised host, I mean a person with COVID and diabetes. So nosocomial infections have to be prevented from the hospital side by forming internal committees to make sure that very stringent measures are taken to control infection and cross infection. So there are other factors, and I guess due to the paucity of time, we can't go on like this. But it's a broad topic, lot of things to be discussed, and for those of you out there who have symptoms, please do not waste time, because these infections spread fairly quickly, and I would urge you to take urgent steps and come to a hospital. Do not hesitate visiting a doctor if you have any of the symptoms of mucormycosis. Thank you.
Thank you, doctor.
Thank you.